But at the same time, we're normally talking about a lot of co-infections. So you would think that, and it's reasonable to say that antibiotic treatment would work in a sense. What is the problem with antibiotic treatments in so much that some patients that go through it do not get better?
So, there's always a time and a place for antibiotics, and I definitely believe that. Antibiotics, the way that they work most of the time, they're best used in an acute setting with fast-growing bacteria. So with Lyme is actually very slow-growing, so that's one problem. But the Lyme can also kind of like, going back to it being stealthy, it can hide from the antibiotics. So Lyme can take on different shapes. So Lyme being the Borrelia, it can go from a spirochete form to a sphere form and then hide in the connective tissue. And then when the antibiotics are gone, boom, it's back out doing its thing, wrecking your system and inviting friends. So it's hard to treat with antibiotics because of that. But also, and so a lot of Lyme literate doctors now are kind of getting into, okay, well, we'll throw different antibiotics at this person and do it long term, which I understand that mindset for sure. And in some patients that probably helps them, no doubt. But the problem there is that, 70 to 80% of your immune system lives in your gut. And it is highly influenced by the microbiome. So those bugs that you have living in your gut. When you're taking an antibiotic, it's not just like a tailored treatment to that bad bug. It doesn't care. It's unbiased. It goes in, it just wrecks shop on everything. So it's killing the good stuff. It's killing the bad stuff. So long-term antibiotics is not just, killing Lyme, but it's also killing your good bugs and therefore damaging your immune system. And, to top it off, antibiotics can be kind of toxic, and some of them are hard on the liver, others are hard on the kidneys. And so if you have a toxic patient with a lowered immune system coming in, getting treated with heavy antibiotics for long term, you are further increasing their toxicity load, or their toxins, whatever, damaging their immune system. And then are you killing the Lyme? We don't know. Maybe you're just kind of like pushing it away and it's going to come out later. So antibiotics, I think in an acute setting, there's reason to maybe give it, and if you catch it at the right time, which is a very small window of opportunity to treat Lyme with antibiotics, but if you can do that, that's fine. But it's once it moves past that phase, which it often does, and it's hard. It's not always the best option.
And I've heard doctors use this analogy that antibiotics are like atom bombs. They just are indiscriminate. They blow everything up in your, insides, basically in your stomach and in these colonies. And what's left afterwards are usually the pests. Now, usually after an atom bomb, there's some sort of, quiet afterwards, right?
Exactly.
It's a burden area, and it's just, scorched earth in a sense. And I know a lot of patients say, hey, I took it and I felt better because everything just it calmed down. But what comes after that settles is usually you have infestation of like cockroaches, rats, and things like that after they survive the atom bomb. And I've heard the doctors say those are, the co-infections, the Borrelia and others, they come out. And now it's worse than ever.
Exactly. Those survivors are awful. They're there to live and thrive, and they will do whatever it takes to take over.
And like you said, they're bringing the guest list with them. And now others come in. And I think that's why a lot of patients ride the roller coaster. I know you mentioned that in the first time we spoke was that it is like up and down. You took the antibiotic, it was a little better, but then you came crashing down after that because that's what happened. You kind of cleared out house a little bit, and it's quiet for a second, but then they're like, hey, it's time to party now, and you're worse off now. You have no defenses.
Exactly, and such a huge part of that is just your terrain in general. So if you have, if you're really acidic and you have a lot of toxins and sludge and bad stuff kind of hanging out in your environment after you kill off a bunch of bugs, well, the bad ones are going to overgrow because they thrive in that environment. You have an acidic environment with all these toxins. They're like, great, this is awesome. Let's overgrow. So you get the overgrowth of the bad stuff, and then you feel bad again.